Marianne Schörling, and I'm a health sociologist. I'm the head of stakeholder engagement at the Geneva Macro Labs, and I will be co-moderating this event with my colleague Robert Zapfel, who will lead us through the Q&A session that will follow the presentation of our speakers. Please note that this event will be recorded, so you are welcome to submit your questions during the presentations in the Zoom chat right at the side of the videos. You will be also able to ask your questions directly when we will start the Q&A session after the presentation. It's now my pleasure to introduce to you our two great speakers. It's Dr. McDavis and Jörn Erbguth, who will help us to better understand the risks and tensions that are associated with contact tracing apps. Jörn Erbguth is our Geneva Macro Labs head of technology insight, and he works as a blockchain and data protection expert. Jörn researches at the University of Geneva. He lectures there as well, including the Geneva School of Diplomacy and University of Lucerne. And Jörn will give us tonight an insight on where we stand with mobile tracking apps. To what extent privacy risk increases when additional data like location and specific health information is collected, and how such risks could be managed. And we will then have Dr. McDavis, who will share with us her expertise in risk assessment in the realm of digital health and human rights. And Dr. McDavis is a special advisor on strategy and partnerships at the Global Health Center in Geneva. Well, Jörn, now turning to you, while I'll stop my screen sharing here, while mobile tracking or mobile tracing of infectious diseases has been available for the last decade. There was the flu phone app in the UK that was developed in 2011. We would like to understand now what's the current state, and the most critical question: could COVID-19 tracing lead to massive surveillance? And I'm handing over now to you, and I see that you already have shared your screen.
Thank you, Marianne. So we are talking about COVID-19 apps, and there are quite a different number of apps around. And at first, I want to distinguish between the different type of apps that exist. There are some apps that collect data for research to answer important questions like: when are people most infectious? What are the most dangerous places? What is the risk of reopening schools versus public transport or churches? Also, names and IDs can be stripped from this data. It is mostly personal data because re-identification is often possible. Research does not need very high levels of participation. 10% participation can already provide important statistical insights. The second type of apps are health passports, like they are used in China. Depending on the behavior of the person, a risk profile can be calculated, which then grants or denies access, for example, to restaurants or trains. The WHO has recently warned against health passports because they are not sure that if you have been infected and cured, that you are immune. So they warn against using immunity passports. The third category are apps that do quarantine surveillance, like electronic tags that control prisoners that are under house arrest. These apps might also check the health status of the person or give some basic health advice. We will not talk about these three types of apps, but we will focus on the fourth type of apps, which is contact tracing. Since people are often contagious before showing symptoms, it is important to isolate contacts of infected persons fast and before they show symptoms themselves. This is the only way we can stop spreading the COVID-19 disease. So when you look at contact tracing in Europe, we mostly have the PEP-PT consortium and the DP3T approach. And the basically the PEP-PT consortium is getting less crowded because people are leaving it because of the centralized approach. And DP3T is a decentralized privacy preserving proximity tracing, sense of centralized privacy preserving proximity tracing. And it's led by Swiss University ETH and EPFL and is now adopted in a growing number of countries. For example, of course, Switzerland, Austria, Germany more or less said they will go for the decentralized approach, Estonia also. So let's have a look at the decentralized approach, see what risk exists with this best approach that is available. So it works between phones using Bluetooth. And it is a little bit like a magician showing you a card that you should remember. And when you are seeing a set of cards afterwards, only you know whether your card is contained in this hand of cards. So every phone randomly selects a card and broadcasts it, and the other phone is storing it, and vice versa. And every couple of minutes, the phone will change the card they broadcast. And of course, phones broadcast some numbers that are more complex than cards to avoid that phones randomly select the same card. So it is made sure that there will at no place the same card being selected and exchanged. So after a while, both phones have a set of cards they broadcasted and a collection of cards that the phone has received. Here we see, for example, that the 9 of hearts and the 7 of diamonds are present on both phones due to their encounter. So what happens now if the user of the iPhone gets ill and then they take a test and the test is positive? So the expectation is that the user will publish all cards he or she has broadcasted. So they will not publish the cards that they have received, but the cards that they have broadcasted themselves. And the other phones, they look what kind of cards are published and they compare it to the cards they have received. And if there is a match, they know that they have been in proximity to somebody who has been infected. And of course, if there are many matches, they know that they are more at risk than if there are just one match. So the issue basically is not the technical contact tracing, which can be made quite privacy friendly, as you see here, but the issue is mainly what happens afterwards. Will those people go into quarantine? Will they be on sick leave, on paid sick leave? Will there be enough testing available? Will this be abused as health passports? Anyway, it will only work if numbers are low, if numbers of new infections are low, because you can't send all contacts of somebody infected into quarantine if you have thousands of new infections per day. And there's another issue here. The issue is of the adoption rate, because both sides of the contact need to have this app running. Means if you want to at least trace 50% of the contacts, you need an adoption rate of more than 70% of the population. Well, the European data protection authorities argue in favor of voluntary usage because this would increase the acceptance. I'm not so sure, given the experience, for example, of seatbelts. I'm pretty skeptical because the acceptance of seatbelts rose when it became mandatory, not before. And especially since using this app does not protect you yourself, but it does protect your future contacts. Even more, given that the most vulnerable group regarding COVID-19 are old men who have a low adoption rate of smartphones. And some of them might even be quite stubborn, resulting in low acceptance within this main risk group. Should we force them to use this app? And if we don't, will be responsible for an unnecessary high death rate in this group? Those are difficult decisions. So I'm now looking forward to the presentation of Dr. Meg Davis, who takes a look on the non-technical aspects of contact tracing. And I thank you for your attention.
Thank you, Jörn. You gave us some really interesting details on privacy preserving and tracing, and I'm pretty sure that our attendees will have some urgent questions to you to answer. We will now have, as you said, Meg speaking on specific challenges of digital tracing from marginalized groups or minorities. Just a short intro, Meg teaches at the Goethe Institute and the Geneva Center for Education and Research in Humanitarian Action. She has over 20 years of experience in anthropology, health and human rights as a scholar and practitioner. And she was also a researcher at Human Rights Watch, founder of Asia Catalyst, and a senior advisor on human rights at the Global Fund. And very interestingly, I'm really looking forward, she is publishing a book next month, which will be about the uncounted politics of data in global health. Meg, you will provide us now with a broader reflection on how some of the risks and tensions could be managed with a human rights-based approach. I'll hand over to you now, and thank you for already having shared your screen with us.
Thank you so much, Marianne and Jörn and Geneva Macro Labs. Really a pleasure to join you today for this conversation. So Jörn has done a beautiful job of setting out the basic challenges that we face, mobile phone apps that track individual movements and that enable real-time health surveillance and case management. And he's really shared, I think, a critical part of the public debate, which is the focus on individual privacy and whether we can find technological solutions to protect privacy, which they're developing quite quickly, which is encouraging. What I want to do is take a step back to think about what happens when we start getting these text messages that say you've been in contact with someone who has tested positive for COVID-19, or when that data is potentially even mapped and put online for the public to see, as was done in China, South Korea, and Singapore. So the data on health and individual movements can really pose threats for everyone, for all of us, but I would argue most especially for women and girls and for marginalized groups. And raising to embrace these forms of contact tracing without putting the right legal and policy protections in place could actually risk undermining the very goals we want to achieve of epidemic control, and especially in a context of fear and blame and stigma. Having trouble advancing my slides. There we go. Okay. So contact tracing is traditionally very classic public health intervention. It was used successfully, for instance, in managing the Ebola outbreak, and it involves trained healthcare personnel who interview an individual to identify where that person has been and who they may have been in contact with during the time when they were contagious. The healthcare worker then directly, and ideally privately, contacts any individuals who've been exposed potentially to encourage those people to take a test and to take steps to prevent transmission. And this data should really be protected by strict rules on medical confidentiality, especially because of the stigma that can cause harm if it gets public. But with HIV, in over 30 years of responding to this epidemic, we've seen that unfortunately, even with highly trained healthcare workers, there continues to be a high level of stigma and discrimination towards people living with HIV and people at risk of HIV, because many healthcare workers, even when they're well trained, continue to be afraid of contracting the virus. And here I'm highlighting a report from Asia Catalyst, which is an organization I founded, but I wasn't in any way responsible for this report, which came out after I left. But it's a very good report which documents through the lens and through the voices of people living with HIV, the kinds of discrimination and abuses they experience in healthcare settings. And in addition, you could look at reports from the People Living with HIV Stigma Index, which is online, which documents in many, many countries similar kinds of stigma and discrimination. So we're now looking at digital apps for the possibility of doing contact tracing work in real time and on a much larger scale, which is an exciting possibility. But we have already seen how that works in China, South Korea, and Singapore. And we've seen that while it did help significantly in those contexts, that also even anonymized data gets into the public domain, and people begin to draw associations between what they think they see and what they believe. Sometimes that's correct associations, and sometimes it's mistaken. It's based on their own stigmatizing assumptions. But there's, especially in a context where you have stigma, blame, and now in many countries, laws criminalizing transmission of the COVID-19 virus, a growing risk that people will try to figure out who was the person who exposed me, and should I publicly take action to draw attention to that person. So for instance, in South Korea, there's a Corona Map website which shows the travel histories of anonymous confirmed patients, identifying them only by gender and age. But people who've seen the map and then get these text messages alerting them to contacts have then sometimes accused individuals of infidelity, of fraud, of being sex workers. There were some online witch hunts trying to track down individuals and blame them for spreading the virus. So this is already concerning. It becomes especially concerning when we think about the risk specifically to women and girls. So for women and girls, now there's a heightened risk of intimate partner violence, or what we used to call domestic violence. UN human rights experts, World Health Organization have already warned that social lockdown is actually, during the COVID-19 crisis, is actually likely to increase intimate partner violence, both because of the increased stress we're all experiencing in our homes, with social distancing measures, school shutdowns, people losing their jobs, the economic downturn is increasing the kind of fraught tensions in the household, and at the same time isolating people from their family networks, social networks, and social services that might spot abuse when it starts to happen. So it's harder for people to access help and support if they are victims of intimate partner violence. And when you couple that with published or potentially publicly shared messages suggesting that someone was moving and was someplace that, quote unquote, they should not be, for women and girls, that means that there's an increased risk of violence potentially from families, from partners, from neighbors, discrimination and stigma, ex-partners, etc., who begin to speculate about movements, and potentially this exposes them to negative repercussions. So that's one risk that I want to flag that I think we should be keeping a lookout for as these digital contact tracing apps begin to get taken up in more countries. The second group, or diverse set of groups that I think we should be thinking about, are minority groups within all our countries. So the COVID-19 crisis, as we've seen, has already begun to heighten xenophobia, racism, and religious tensions. So for example, in China, there are dozens of Africans in Guangzhou who have reported being evicted from their homes because of inaccurate theories that they're spreading COVID-19. On the other hand, we have people of Chinese and other Asian descent in other countries who are also experiencing violence and verbal abuse, for instance, in the US. Roma people in Europe, different parts of Europe, Hispanics in the US, Muslims in India have all been attacked and blamed for spreading the virus. And in South Korea, while we didn't see that specifically, we did see people identifying specific businesses and boycotting them, or in some cases, businesses that were fingered for spreading the virus then got extorted, or attempts at extorting bribes from them to not have them publicly exposed. So I think we just have to understand that this kind of tension around the virus and the transmission of the virus, and especially now with a growing number of countries with these criminal laws criminalizing transmission, increases a number of different kinds of risks to groups that have historically experienced discrimination. My book, which Marianne kindly mentioned, The Uncounted, which comes out in June, shows that in the HIV response, we've seen that mapping of groups such as sex workers, just by healthcare workers, to try to identify hotspots, for instance, brothels, street corners where people gather. When you have those mapped in contexts where sex work is criminalized, sometimes sex workers are then rounded up for arrest. Even if the mapping was not done for that purpose, it's done for the purpose of saving lives and getting people HIV services and information. But the data, once it's out there, can be used in other ways. So I think this is a second concern, in addition to the concern about women and girls, that digital contact tracing could potentially accelerate discrimination, violence, and risks that are already existing in many of our communities, but it just amplifies it. And what that risk means is that some of the people we most need to reach, these are the people who are already marginalized, impoverished, living potentially in contexts of overcrowding, potentially don't have access to adequate water or sanitation. Those are the people we most need to reach, and it may actually be hardest to reach some of those people because they may be actively avoiding having data gathered around them that could expose them to risk. And we've seen this already in Singapore, unfortunately. While Singapore did a very good job with the digital contact tracing apps of finding a lot of cases, they actually missed over 700 migrant workers from India and Bangladesh who were living in crowded dormitories and who apparently, I guess, did not download the apps. So, way forward, I think these are some of the questions that lawmakers are starting to think about, which is great. There are some more of them that have maybe not yet been adequately considered. Who owns the data? Who can use that data? Who can access it? Who will it be shared with? Will the data be restricted to specific purposes and time periods? How will decision-making be done in a way that's transparent and that can be accountable to communities who are affected? Will there be an appeals process? So for instance, in China, there were cases where people were wrongly tagged as COVID-19 patients, and that led to all kinds of negative repercussions, loss of housing, loss of employment, et cetera. So will there be a process for appealing if there are errors in the data? And how, especially, will the rights of women and girls and of marginalized groups be protected as we think forward about what some of these risks may be? Thanks, I look forward to the discussion.
Thank you, Meg. That was wonderful. I mean, you touched on really well on several points that matter to post-COVID-19 reconstruction. I think you made it clear that we do need a human rights-based approach while we discuss this technological innovation. I see now that we already do have a couple of questions in the chat, and I do encourage everyone who has not submitted a question yet to do so, or to give us a sign and take the mic and directly ask your question. I will now invite Robert, who will guide us through the Q&A session, to take the floor and select the first question that we have for our speakers.
Yes, hello and good evening. My name is Rob Zapfel. Thank you very much for posting a couple of questions in our chat already. If you haven't done so, please, you find the chat button in the webinar that we are just attending, and just pose your questions if you like. Thanks to our brilliant speakers for sharing your thoughts with us. And let me just start with the first question to Meg. In response to the slide about HIV that you've showed, one of your first slides, and that's about the HIV response. Has there been any good practices to gather the data on marginalized groups that work to address some of these risks?
Thanks very much. Yeah, fortunately, there are some really good practices that we can learn about from the HIV response. And one of those is really the mobilization of communities and giving people at a community level both information about health and about how to protect themselves, but also training groups to gather their own data in ways that are ethical and that are scientifically sound. And in the book that I mentioned, one of the cases that I follow is a community-led data gathering effort in the Caribbean, Eastern Caribbean, where LGBT groups, sex workers, youth, we're working as leaders of those communities. We're working alongside social science researchers, health officials, to gather data from communities with whom they already had existing relationships of trust. And that kind of work is not as speedy and as sexy maybe as a digital contact tracing app, but that kind of building of capacity can really be very powerful as a way to gather data that is otherwise quite hard to gather.
Okay, thank you very much. I have just another question to Jörn, actually. One very pragmatic question is, what happens if my phone breaks or if it gets lost or stolen? First of all, could the thief or the one who's got hold of it break into that and abuse the data? And the second question would be, then can the data be recovered on my new phone? What is your opinion on that?
Well, basically, you have to decide what side you will want to lose on. And in the privacy-friendly approach, there is pretty much nothing you can do with the data. So you could go to a doctor, and if you're infected, signal this phone as your phone, and so your contacts might be frightened. But this is basically just the most negative thing that can happen, and there's no tracing possibility using this data. And of course, the disadvantage is if you lose it and you cannot recover the data, then you might not be able to warn your contacts about being infected. It's not out yet if this data collected will be stored in the cloud of Apple. So if it will be stored in your backup. Passwords, for example, are not stored in the backup. And if you have to recover your phone, you have to re-enter your passwords for a reason. So the question is, will those IDs be stored in the cloud, in the backup? If yes, of course, the access of Apple and Google would be more possible, would be easier. And if not, you cannot recover this data, which would make another little gap in the tracing, of course.
Okay, thank you very much. I have another question to Meg. Someone argued that before privacy is a freedom dilemma. What is your opinion on that?
I'm not sure I understand. What does that mean exactly? Maybe do you have a sense of what freedom dilemma would mean?
Yeah, I think as far as I could tell from the question I have received in the chat, was about talking about freedom or personal freedom and privacy versus the data collection.
Yeah, I mean, I think, we do have the right to privacy. That is a fundamental human right. States also have the right to, in the case of a national emergency that threatens the state, which I think for many of us, COVID-19, we're approaching that point. So states can then suspend certain human rights, but it has to be governed by law. So it can't just be a random arbitrary decision. It has to actually be a legal process that frames that suspension of rights. There also has to be some time limitation. It has to be the most minimally restrictive approach possible. So it's not the case that, and I saw one question here is asking about whether these are, what Philip Alston, the UN Special Rapporteur on the Rights of Persons in Extreme Poverty, has called, these kind of Trojan horses, in which these apps then begin to expand state surveillance into our private lives. And that would actually be prohibited by human rights law. So getting states to respect human rights law is another problem. But under my understanding of the standards, it's not the case that states can just put in place these apps and then surveil us forever.
Okay, thank you for that. I have another question for Jörn, just to alternate a little bit here. So about the technical efficiency of the Corona apps, and in particular, the good question is what happens in a country where not all people have a cell phone reception or an internet reception at all? How would that possibly come to work?
Well, you don't need a cell phone or internet connection to make them work. Bluetooth is local, so you need to have an internet connection every now and then to synchronize the warnings. Of course, this is needed, but you don't need a continuous internet connection. And actually, in New Zealand, there is an approach to buy millions of Bluetooth cards that do the tracing without having the need to have a smartphone. So this is possible. Of course, there is a cost associated with it. And of course, you need some kind of internet connection, every now and then, maybe every day or every second day, otherwise it doesn't work. So, but we have to care about populations that do not have smartphones in order to protect them. And there are different ways to do that. And concerning, of course, the dilemma that once we open the door, it might be very difficult to close it. Of course, Apple and Google provide the APIs, and they have forced governments like the German government to use a more privacy-friendly approach. And I think it's a good way that they act in this way. But of course, if they want to manipulate the operating system and collect data, they can do so. They will always be able to do so, and it will always be hard to discover that. So we are at the mercy of those who produce our operating systems. That will not change whatever we do.
Okay, thank you very much. I have a question from Ryan Maya about organizations and governments and research projects. Ryan, maybe you want to pose your question yourself? Ryan, hello, are you here? Can you hear me? Okay, I do that for you. So the question was to Meg, are there any organizations, governments or research projects that are proactively building health info sharing capacity between vulnerable groups and leaders to prepare for future health crises?
That's a great question. I don't know of initiatives like that. It doesn't mean they don't exist. I think one of the real challenges that we've seen has been lack of investment in most kind of community-based organizations that work on health and human rights issues. You know, we've tended in health, I think, in global health and in national health initiatives to really focus on large institutions that can reach a large number of people, but to really strengthen what, when I worked at the Global Fund, what we call the community system is not often a priority, really getting the money down to the grassroots. So this project that I saw in the Caribbean is the only one I've seen of its kind so far. There may be others. I hope there are others. But what was interesting about that one is that the groups had all lost their funding because the Caribbean had become less of a priority for the big global aid agencies. And so they pulled their money out of the Caribbean because HIV seemed to be relatively under control there, and moved the funding to sub-Saharan Africa as a bigger priority. So it's a tough decision, right? You have to set priorities. But so that was a decision they had made. As a result, all these community-based groups had lost their funding. And so they'd more or less become dormant. And the project that I was able to witness and observe came back in, used the data gathering to build capacity and build strength in the community-based organizations so that they then not only had the data, but understood their community better and could begin to design interventions that would actually reach people who were most marginalized. For instance, teenagers who are LGBT, very, very hard to reach and hard to identify. So I thought that was a very exciting example. There may be others, but I haven't seen them. But maybe COVID-19 will change some of that. Let's hope so.
Thank you for that. Gareth Crawford, you had posted a question also to Meg. Would you like to ask a question yourself?
Sure, thank you, Robert. I think Meg raises very important issues for vulnerable groups, and the alternative she suggested about local community-based tracing with trusted parties is a great alternative, although it's going to be slower and more cumbersome. Are there any practical steps that you can suggest for measures that maybe can be built into digital apps ahead of time that are being proposed in order to address some of these vulnerability concerns and to provide the protections that are necessary?
Yeah, Gareth, that's actually probably more of a Jörn question because I'm not a technical expert, but I would just say before I pass the mic to my colleague that I totally get the urgency. I mean, we're all feeling that this, calls for unprecedented levels of speed. But at the same time, there are some issues that are not technical issues, that are political issues that require political solutions. And I think that's the fundamental challenge in health. We're often looking also to a silver bullet that's a technical silver bullet. And we've come up with some amazing silver bullets, but actually reaching people who are most hidden and most at risk has to be, I think, a different kind of process. But let me bounce this question to Jörn and see if he has thoughts.
Thank you.
Thank you, Meg. I agree with you. I think the technical solution can be the same, but you need to work around it. So you need to distribute phones or tokens to people. You need to talk to them, to inform them, to convince them that this approach is trustworthy and it's helping them. And then, of course, if somebody has been alerted of having been in contact, you need to support them. You need to give them the possibility to be tested in a trusted way. So all things around it are more important, I guess, than the technical solution itself. But the technical solution can be used, I think, in any context.
Okay, thank you very much.
Thank you,
I have another question from Stephanie Tischhauser here about the balance of freedom and community. Would you like to present your question yourself?
Might be on mute there.
Can you hear me?
Yes, now again.
Yes. I wanted to ask, like, yeah, is it a good balance to have contact tracing apps regarding of personal freedom? I mean, to which point do we need to accept these kinds of thing, like to be forced to stay at home and forced, maybe we will be later forced to have this contact tracing app. And I really understand that we need to protect the community, but to which point should we give up our freedom to do so? Thank you.
Well, maybe Meg can also say something about it. I think this is a general balance we have to strike, and this is not an easy balance, because if we do it halfway, we won't reach anything. So if we don't contain the virus and we only do 50% of the work there, the virus will spread, and we will have the damages of containment and the damages of the virus. So we need to find a way how to really contain it and at the same time preserve our rights as much as possible. And the good news is if we contain it more, the restrictions will be shorter. And but this is the whole debate which is currently going on about lifting restrictions and what is the best strategy to fight the virus. And it involves all kind of restrictions, stay-at-home orders, and tracing. And we have to balance all these restrictions concerning the efficiency towards containing the virus, and of course, what should we accept? What kind of risk can we accept, and where do we need to be more restrictive? For example, do we need to close schools? Or do we need to close churches? Maybe we cannot open both of them, and we have to make decisions that may be hard for some people and may not be obvious. And also regarding the contact tracing is not the silver bullet. It can support the containment in a certain situation, and it can basically reduce other restrictions that would otherwise be necessary. But it's a whole lot of discussion, and especially when you see the discussion about all those these kind of apps becoming mandatory. Should they become mandatory or not? Most people say not. And of course, if the acceptance is high without making them mandatory, it's the best way. But what happens if the acceptance is not high enough? What is then the best action to take? Should we insist on individual freedoms? Should we rather restrict other freedoms, or what is the way out? And I'm puzzled, as probably everybody, about which is the best way to go, because I don't see the silver bullet there.
Maybe I can come in on this one, if that's okay.
Sure, please.
Yeah. So I think this is a really interesting discussion, and this is really what it comes down to ultimately. And it's actually one we just spent a lot of time talking on in a podcast that I moderated, which will come out on Friday, called Right On, in which, you know, we were talking just about lockdowns. So we weren't talking about apps, but about these shelter-in-place regulations. And how, you know, for people like me or Jörn, lockdown is, you know, it's a little bit depressing. It's not the most fun we've had, but it's fine. We're fine. We can get on Zoom and we can do our work and we can do what we need to do. But there's a disproportionate impact for some of the population. And that's what we have to really think about, at least from a human rights perspective, that when we impose these new measures, they don't affect everybody equally. There are some people who are more affected than others in ways that are harder. So for instance, with lockdowns, we have to think about the people who are so-called essential workers, people who are medical workers or who are running public transportation or something else. How do we ensure that those people are protected and have their right to health protected? So that's the first point I would make. And the second is that I think the tension, this trying to choose between freedom versus health, this question Stephanie raises, which is really one that we've thought about a lot in the HIV response. It's not an either or situation, because ultimately, if we do not reach the people who are most vulnerable, whether it's for HIV or COVID-19 or something else, then we fail. We've just failed. We've lost the battle, right? So if we have, you know, as they did in Singapore, you reach lots of people with the digital contact tracing apps, but you have 800 people in a dormitory who are exposed to COVID who are not reached because nobody thought about their needs, you're going to have a resurgence and you're going to have the cases coming back again. So whatever measures we put in place, we have to think about not the, you know, me or Jörn type people. You have to think about the people who are most marginalized, because if we put them first, we'll know that the system is working for everybody else.
Thank you very much.
Thank you. One interesting question is about the about some solutions that are out there based on blockchain to Jörn. It goes, there have been numerous blockchain solutions announced to track and prevent the spread of COVID by providing superior anonymity for smartphone location data. And now comes the question, what in your opinion are the primary challenges and barriers to their implementation?
I'm having a bit of a hard time to see what blockchain can do here. Basically, blockchain is storing things for eternity, and even when the data is very much anonymized, not totally anonymized, why should we store them permanently? Of course, there are some points where you could use blockchain. For example, when somebody is infected, there will be some health institutions that will prove that the infection is real to avoid abuse of the system. So when you get a positive test, you don't get a positive test by yourself, but it will be a doctor or a healthcare facility who tests you and who tells you that you are positive. Then they will have to sign your publication and of the cards or the IDs that you have emitted. And in order to prove that they are really healthcare professionals, we could use some blockchain certificates. So there are some points where you could use it, but it's not the main thing that can help us there. It is just some support for trust chain where you need to verify the authority of healthcare professionals, for example. Otherwise, for the tracing itself, I don't see it. There have been some discussion about numbers or publications on COVID-19. So you could put them on a blockchain or verify them with a blockchain to make sure that they are not manipulated afterwards. But I don't see this as a main risk right now, because currently attention on COVID-19 issues is very high. So everything that will be manipulated will be discovered if it has been manipulated after publication, because there are so many people taking care of it. It's decentralization is working there even without blockchain. The other issue is, of course, numbers that are wrong when they are published, but blockchain cannot do anything about that. So if a country does not publish correct numbers, there is no way blockchain can detect that.
Okay. And yeah, I mean, I agree with you. This is blockchain actually something to store things for eternity. And then at the same time on the contact tracing, you try to get rid of the information after 2 weeks. Seems to be a contradiction on first sight. That's true. Marianne, you had a question to Meg?
Thank you, Rob. Yeah. Meg, concerning what you just have said, do you see any recommendation that we could give to policymakers to lead us through these difficult questions that are at the end ethical questions, right? We do have new technologies in place, but it seems like we need a new governance process that would allow for a more interdisciplinary approach to discuss with representatives of all levels how we want to go about the price that we pay for our health or for our freedom.
Yeah, I totally agree, Marianne. I think the government should do exactly what Geneva Macro Labs has done, which is to have human rights people and tech people in the same conversations, because too often we are in parallel streams. The human rights people are talking to the human rights people and the tech people are talking to the tech people. So to have conversations like this that bring us together, I think is a real breakthrough. And I hope that we can do more of that. But more specifically, I think governments have to be taking very aggressive measures to combat stigma, to reduce fear around the virus, which is hard when there's so much that we don't know, but to the degree that we can. Certainly should not be passing laws to criminalize transmission, because that really drives people underground and will make people very reluctant to install any kind of app. And think about how, as a protective measure, what kinds of steps can be taken to prevent intimate partner violence, to ensure access to services for people who are survivors, and how to protect minority groups from the risk of discrimination, blame, or abuse if they're targeted as well. So putting those kinds of measures in place, I think, is the responsible first step to do. Thanks.
Thank you. The interesting thing to Jörn is what about false positives in the tracing apps and their implication, or maybe a question to both of you. You know, now we're talking about tracing apps. What about false positives and the impacts, you know, on society, on individuals?
Okay, I think we have to see that false positives is part of the game. So we don't know when people are being infected. We just can know when they have been in contact. So regardless whether we put the limit at 2 meters or 10 meters, most people that will be alerted that they have been in contact with somebody infected will not be infected. So the false positive will be the standard thing, which is, from an epidemiological standpoint, the correct thing to do, because we have to be very cautious and we have to find all people infected and test a lot of people that are not infected but have been exposed to a certain risk. But this, of course, increases the human right risk that we flag the wrong people, that we flag people that have not been infected and that will then be confronted with restrictions in their life. And this will not be fair, of course not. It depends on the context, on the job you're doing, on the situation you're living. If you are living in a more crowded place, you will have more contacts and the risk of being flagged is higher. The risk of being infected is higher. The risk of being falsely flagged is also higher. If you're working in a supermarket, of course, the same thing happens to you. So the risks of being falsely flagged is high. And we have to make sure that these people don't have too many negative consequences because they have been flagged as risk, as people that might be infected. So this is basically, I think, there's a human rights task to make sure that this has that we can reduce the negative consequences of these false positives as much as we can.
Okay, and Meg, I think you also mentioned stigmatization, and that might have, or that might occur with these false positives.
Yeah, I think it's a real risk that we've seen already happen in some countries, for instance, in China, with really serious repercussions, where people were, you know, because in China, of course, they have the system that Jörn talked about, in which you have passports that give you a code that clear you to travel and to do certain kinds of things. And I think, you know, again, transparency and accountability have to be built into the system, both for how the data is gathered, so that if there are errors, that it's possible to get them appealed and get them fixed, but also for the decisions that are made using those data points. So if you start having algorithms making decisions that affect all of our ability to move, to work, to get access to housing or anything else, those decisions we can't just throw up our hands and say, oh, it was the algorithm that got it wrong. There has to be some kind of process of accountability for those as well. Thanks.
Okay, thank you very much. I have one last question from Stephen Ukowitzer. Would you like to pose your question yourself, potentially? Stephen.
Might be on mute.
He's not on mute, but okay. I'll try to be helpful here. So he writes, still if innovative measures are put in place like Google and Apple's OS, and it's regarding the usual suspects here, like Google and Apple with their operating systems. Enhancements for contact tracing, these features needed will be resident in the phones from inception. Then there is nothing stopping these companies from leveraging these new data sets for their own purposes. Example, Google has been using proximity Wi-Fi and cellular data for years to enhance all of their services, maps, traffic, etc. It is really important that the human rights and privacy implications are tracked and known, even in the absence of users explicitly endorsing tracing, as the phones in their pockets may be doing it anyway without explicit application installation or their knowledge. So what's your opinion about that?
Yeah, I completely agree. I mean, Stephen sounds like he's very well informed about these issues. And for those who haven't read it, I really recommend Shoshana Zuboff's book, Surveillance Capitalism. It's a big book, so also you can just read like the introduction so you get the basic idea. But she talks about how, you know, these tech giants who have become more powerful than many of our countries are now using our data to make all kinds of decisions that shape our lives. And I think it's really time to think about how we can break up those tech giants and make them more susceptible and more open to competition that would generate other kinds of solutions that are more respectful of our privacy, but also how we begin to regulate those better, because I think our laws and policies are really playing a losing game of catch up with entities like Google, Apple, Facebook, all the rest. Thank you.
If I may add to that, another book you should read in this context is Edward Snowden. And he describes very well how this is being used currently, and how secret services use Apple and Google to collect all kinds of data. And this, of course, is a real risk. And Apple and Google have shown some engagement in stopping governments directly using these interfaces, and of course also other apps using these interfaces. But we also have to stop them abusing this in a way that is not possible or not easily possible to monitor for us. And of course, this information is very interesting for secret services. And there is a high risk that they will say, well, currently we only know that you have been in a distance of maybe 100 meters in the same building, but you might be floors apart and we don't know exactly your location. But with this, we could know who has talked to whom. And this is some information they really would like to know and would like to collect. And we have to make sure that this will not happen. And I don't think it will be commercialized so early, because there is a high public vigilance checking this, and if as a commercial provider you can use this, they will see that this information is abused, and platforms will maybe not dare to do that. But if they use this information, collect this information for secret services, it is done in a way that is not visible to others, and I think this risk is real.
Absolutely, yeah. Thank you for your answers, and quite disturbing. Yes, Snowden's book. Book is the keyword, Meg. I've seen a couple of questions around the book. Can you just mention a little bit about the book you have wrote, and where we can get it and how we can get it?
Thank you so much. I really appreciate it. The book is called The Uncounted: Politics of Data in Global Health. It's being published by Cambridge University Press. It'll officially be published June 11th is the publication date. It'll be a hardcover and an ebook first, which will be a little bit more pricey for libraries, but the paperback should hopefully be out in September, October. And it really looks at the issues of how we set priorities in global health, why we're failing to end the global HIV pandemic. And part of it has to do with issues around stigma and data we've been talking about today, with the populations who you most need to reach being the ones that are hardest to win the trust of and get data about. So thanks so much. I really appreciate the chance to share it.
Thank you, Meg. That was wonderful. Also, thank you, Jörn. You are both great speakers, and I really loved how you complemented each other in your expertise. Also, thank you, Robert, for leading us through the Q&A session. And I'm pretty sure all of us, we have some pretty good takeaways from today's webinar that we should keep in mind, and we are all shaping together the post-corona world that we are approaching now. Our conversation about sustainable future will not stop here this evening. Next week, we will speak about the humanitarian response to COVID-19. We will have a webinar with the CEO of MedAir and the Chief Health Economist from the Global Fund. And the weeks after, we will focus in particular on the effects of the current crisis on the economy and on finance. We will have first Professor Robertson from Texas A&M University, economist Maria del Rio Janona from Oxford University, and we'll then continue with Dr. Ralph Moser from the Swiss National Bank and Dr. Ralph Jami from the IMF. So lots to share, and we are hoping that we can welcome you there. I invite you to follow us on social media, and I'll just share my screen to show you our contact details. Voila. You are more than welcome to share your thoughts, further questions and comments that we might not have covered tonight. Through the various channels, we will also update you on the upcoming webinars that I've just mentioned. And so, yeah, thank you all for connecting with us. As we close, let's remind ourselves that the challenges ahead can only be tackled collectively with solidarity. So stay well and goodbye. Thank you.
Thanks so much. Bye-bye.
Thank you. It was a pleasure.